Some musings today, doctor. When I went to dental school, we had 6 ladies, 6 girls in our class of 62 or 3 we started with. So it was about 10%. And by the way, that was a huge percent compared to the year before, which had been, I think, maybe 3, and the year before that, maybe 1 or 2. So women in dentistry back then were kind of unusual. In fact, I remember asking my very dear friend who was a pediatric dentist who I talked to about going to dental school, asking him, what about women in dentistry? Are there many? Is it okay? Is it something that happens? My choices were either dentistry, because I had these friends who were in pediatric dentistry, or cardiology, because I was practicing critical care nursing, and I knew there were women in medicine. But I wasn't quite sure what I thought about my role in dentistry. And he assured me, why not, of course. Well, the bottom line was, here I was, a dental student, one of 6 women. I think we ended up graduating maybe 4 to 5 out of that. I think we lost 1 or 2 along the way. But today, over 50% of the students in dental schools are women. That's an amazing change. Now, I will tell you that with all the worries that people have about equality and opportunities and women getting to do this or that or the other, I never, ever experienced anything except acceptance. Never. Whether it was in nursing, where I was administrative, and the top-level docs accepted me completely and gave me free rein to do things the way I needed to do them and to respond to me beautifully. Whether it was in dental school, where the professors were absolutely fantastic, I never had anything but acceptance. So I have to tell you that I don't think that today's young women or yesterday's should worry about that. Just keep going. Do what you want to do. Have a great life. That's the point. Anyway, I want to tell you this women in dentistry thing, a little story that makes it really fun. So when I was thinking about it, I remembered a story of a mom who came in one day to the practice. She had a little boy who was about 6, and she came for, I think, a recall. And she said to me, Dr. Chris, would it be okay if Dr. Kenny saw my son today? And I said, sure. She said, well, let me explain why I asked. She said, I know you always see him for his exams, and I love Dr. Kenny and I love you, but the reason I'm asking that is that his pediatrician is a female as well. And the other day he said to me, Mommy, can boys be doctors? Wow. So it's really interesting when I have seen over the years going from a very few women in dentistry to many women in dentistry today. And I want to just make one final bit of musing with you, and that is that it was very easy for women to go into pediatric dentistry, like myself. Why? Because I loved kids, because I loved children, and I loved parents. I loved the other moms. Think about it. And women love to talk with other women. So it was a natural to go into pediatric dentistry. But when I discovered orthodontics as well, oh my gosh, the heavens opened up. Orthodontics for women is just as fantastic. And there are a lot of women going into orthodontics today. In fact, on my Instagram, I see all these gorgeous young ladies finishing up and becoming orthodontists. And it just is so exciting for me to see women doing things that are so good, because guess what? Again, they're working with children and they're working with moms, and they get to chit chat with the moms. They get to reassure the moms. So I think there's a real place for women in dentistry and in medicine, of course, but more than that, there's a place for the mix of a woman and a man working together to serve the needs of patients. The children need both, the parents need both, the patients need both. It's fantastic to see how we come together as a team and support each other and blend together to make it all really, really good. So, musings for today. Have a great one. Signing off.